Hi, I think I sent you the Zoom meeting address way too late, so I apologize for that. Having said that, I can make you a video and show you what I was going to show you anyway, and hopefully this will help. If it doesn't, let me know and just reach out back to me at dale.larson@utah.edu. But I have a few ideas for you to find things. And most of them are scholarly. All of them are going to be evidence-based, which is, we'll just go off of that. Okay, so from libutah.edu, from the library catalog, if you're off campus, make sure and log in here, because a lot of the things that we will find are linked elsewhere, and we want to have you have free access. So first thing, go to Advanced Catalog Search. So I'm going to look at 3 questions. Assess the severity of a health issue of choice, obesity, within a local city, West Valley City. And then we're going to be looking at predisposing and reinforcing factors that influence obesity, and then health interventions, which I'm presuming are at that like city level. But there's all sorts of different things that we can find. This is a huge global issue, and I bet even like the World Health Organization is writing about it. Yeah, so even the World Health Organization, 1 in 8 people in the world were living with obesity in 2022. Wow. Okay, so there's some data that's not scholarly, it's just data that they gathered that scholars then use. Okay, so the first thing, West Valley City or any other city typically doesn't have like obesity rates where people gather that data officially. Part of this is due to the scholarship and the research happening at like the national level. So the best place to find prevalence of obesity probably is at like the state level, but things like that are, and I'll send you these links, but the Center for Disease Control in the United States will gather this data. I'm keeping notes over here. They will gather this data, and then like taxes in the United States pay for this, and they'll do all sorts of different things like looking at incidences of the flu or COVID-19 and obesity and interventions and things like that. So it's kind of like for the good of the public health is what they gather from. So it's really good. It's very valid. It's very evidence-based. It's not scholarly per se, but I'll talk about that in a minute. But if you click on this obesity prevalence map, it will give you something where you can see as of 2023, you can go state by state. And you can see if you scroll down, there's like a big PDF. I'll send this to you if I can, but I think it's really big. So I'll try and send that to you. But it talks about how they gathered the data, and then they look at specific populations. So this is like their population is self-reported weight and height. And then they go into ancestry. Ancestry by the US Census is determined by somebody's identity, whether they say they are something or not. But they like play with statistics and skew it. So you can see things like this, but you can only see like Utah as a whole. So the non-Hispanic white adults in the state of Utah have a lesser than Nevada, but greater than Colorado. So that's kind of like the best level you can go to. You'll have to ask your instructor if that's okay. But if you, I think if you wanted to, I don't know if you could find them for West Valley City. Be that as it may, here's a whole bunch of other places to start. So, when we're looking at predisposing and reinforcing factors, you can go to the library catalog, and you could go to the advanced search. And if you just type out obesity, you could do predisposing or reinforcing factors. But I found that causes was pretty good too. And there's a lot of people that are talking about approaches or campaigns, or there's a lot of money being invested in this because it's an issue that's making people die early and have a lot of hospitalization and things like that. How do we get around the stuff that's too old is you can go down here and you can say, I don't want anything from the 1700s. I want to come up to like the pandemic era. Then you can find some things. Do you need to find a scholarly peer-reviewed article? What you can do, instead of just going into the books, you can go into peer-reviewed journals. Those are like the peer-reviewed scholarship, but these are going to be very focused. So it's going to be about like diabetes or cats with obesity. So there's another place to go, but I would say if the books are going to work for you, that might be a great place to start. So instead of peer-reviewed articles, go to books. And there was one, oh, this one looks really good. Latin America had a really good campaign to change labeling on children's food, like cereal and soda, that has made a difference, where they couldn't do that in the United States because of the market-based economy and things like that. So these might be a great place to go. Oh, and how do you get into the books? You click on the title, and then you click on the title again, and then you should be able to get into the book this way. And sometimes it'll be PDF, sometimes it'll be inline text. But again, make sure you're logged in here first, or you might not have access to those books. Okay, let's go into the databases. Are you familiar with databases? The library catalog searches a lot of those, but you can go into specific ones. So I'm going to go into medicine. Let's go into like the predisposing and reinforcing factors. So if you just go to medicine, these are all medical databases. I'm going to show you one of my favorites because it's the easiest to get into. It's called Medline. Medline Complete, the EBSCO one. In this one, here's my trick number one for you. If you type in obesity, and then I wanted to do causes, it will give you all of these other keywords that you can use. So I'm not sure that predisposing or reinforcing is in there, but factors or determinants are in there. Oh, that's funny that they put factors twice. So we're only in medicine. So this is like health sciences, doctors, physicians, surgeons, and we're looking at causes and factors in obesity. This is where you'll get the really good medical stuff. And again, come up to more recent stuff. And you'll see, and we could do academic journals, there's still 38,000 articles. Genetic obesity, childhood obesity, you might have to narrow it down even further, but you should be able to go through these and find a good one. Say, for example, this is one that you wanted. So genetic predisposition is a known thing. If you go into this and you like this article, if you want to see the full text, you just have to find it over here. And there's also a citation generator on this side. So if you wanted to look at the whole article, there's not going to be one perfect article. You're going to have to pick an article to use, and then that will be okay for it. But what you can see, look at that. There's a quote right there. Genetic abnormalities are responsible for 70% of early onset obesity. Because this article is published in this database and it is scholarly, you don't have to necessarily read all of the data and all of these other things, but you can grab a quote like that and then move on with your paper, okay, if that makes sense. The next one, so Medline's going to be really good. How about health interventions? There is another fantastic database called PAIS. It's not categorized in here, so you have to go to the letter P, and it's at the top. This is all about public policy. So these are case studies of where there was an incidence of obesity, and then this is where a city or a country had an intervention or a public health campaign or something like that. So I'm going to go to advanced search. And I don't know if you can see this in the video, But I did intervention or campaign or public health in quotes, so those two words stick together. Or you could do or health intervention. But again, this is looking in public policy. So this is countries and cities that have done something. Oh, and let's have it be the last 3 years. And let's have it be scholarly peer-reviewed. So we won't necessarily be able to see what's going on in West Valley City, but we can, if you wanted to, you could say a good health intervention would be using media or social media to promote drinking water instead of soda. That could be a campaign. That's an intervention. Here's an example of somebody that had done that. If you go into this article, you can see who did it. Oh, then there's like media advocacy. Oh, the whole abstract is a lot bigger. So you can see the pros and cons. Oh, okay, New York City did it. So you would just go through these and look and see, is there one that you're interested in? Policy assessment. Looks like soda and sugar drinks are a big issue. Alcohol, mobile technology is an income. Sugar reduction policies. So they're reducing sugar being sold, maybe. Nutrition. So it's going to be a crossover. There's going to be some medical and some things. Oh yeah, here's a population where they're doing a trial of Australian kids. And all these, again, if you go into these articles, they have citation generator right here. And they have the full text of the article right here. Let's see, what was the last thing that I was going to show you? I think that was everything. You can also do, out on Google, let me just show you this last one. Public health campaign, do a colon, and then do whatever you're campaigning against, obesity. And it will have, these are not scholarly, but these are actual campaigns. So here's obesity action, there's the World Health Organization, there's Michelle Obama's campaign. So, obesity. That's funny. So there's the CDC. So that you can find stuff out on the open web as well. Let me know how it goes. I'm sorry that we couldn't meet, but I hope this helps.